About monkeypox, brace yourself for another lockdown. The dreaded Professor Salim Karim has resurfaced on a public stage. The lockdown is on the horizon. The Bill Gates funded Africa Centers for Disease Control and Prevention, Africa CDC, has this week declared monkeypox, MPox, as a public health emergency. Africa CDC Director General Dr. Jean Kaseya said, "Today, we declare this PHECS to mobilize our institutions, our collective will, and our resources to act swiftly and decisively. This empowers us to forge new partnerships, strengthen our health systems, educate our communities, and deliver life-saving interventions where they are needed most. There is no need for travel restrictions at this time." The World Health Organization, WHO, followed suit declaring monkeypox a public health emergency of international concern. New sexually transmissible strains of the monkeypox virus in an emergency not only for Africa but for the entire globe. One wonders if monkeypox as a public health emergency on the African continent is a play on words, considering that many disparagingly refer to us Africans as monkeys. To add insult to injury, the monkeypox is allegedly sexually transmitted, the same claim as with HIV/AIDS. When will we Africans stop being portrayed as the wretched of the earth? Let's not forget the smallpox outbreak falsely attributed to dirty blankets and which wiped out almost the entire population of the Khoi in the Western Cape province of South Africa and paved the way for the colonization of the Cape. I fear that this public health emergency will soon morph into a national state of disaster, plunging the entire country into yet another lockdown as the whims and mercy of the expertise of Professor Karim. During the COVID-19 lockdown, Professor Karim played a pivotal role as a chair of the Ministerial Advisory Committee on COVID-19. I requested Professor Karim to appear in court and produce within 14 days an isolated and purified physical sample of the SARS-CoV-2 virus, not a culture isolate or any mixture within which the supposed virus is, no photograph or the NRS sequence only, to me at a place with security measures of his choice. I was flabbergasted to learn that Professor Karim informed my attorney that he, Karim, does not work in that position anymore and that we should not request such information from him nor from the president. According to him, such a request should rather be directed only to Dr. Nkosazana Dlamini Zuma, the then Minister of Culture. The lockdown means the suspension of constitutional democracy and the Bill of Rights. The 2020 lockdown turned this country into an open-air prison ruled by dictate, where effective midnight tonight was Ramaphosa's favorite despotic refrain. Lockdown is a prison term, meaning confining prisoners to the jail cells. However, it was recently been commanded as a term for a public health emergency. The COVID-19 vaccine rollout was a mass public medical experiment, the like of which has never been conducted before. There are many reports of COVID-19 vaccine injuries. Surely, this necessitates an independent public investigation, a commission of inquiry akin to the Zondo Commission before we plunge into another lockdown and mass vaccinations. The Gates Foundation is heavily invested in the vaccine industry, which is always the go-to treatment for any so-called virus outbreak. Hence, a vaccination drive for MPox is sure to follow. Professor Karim is currently a member of the Scientific Advisory Board for Global Health at the Bill and Melinda Gates Foundation. Need I say more? Believe it or not, SARS-CoV-2 virus has not been proven to exist. On Feb 16, 2016, the Stuttgart Higher Regional Court in Germany, in a dispute between two virologists of the existence of the MERS virus, ruled that the methods employed to determine whether the virus exists or not were invalid. The method that virologists use to prove an existence of viruses are what they refer to as cell culture. The technique roughly works as follows. A swab is taken from the suspected infected person, then placed in monkey kidney cells among other chemicals. When there is a reaction, usually the cell dies. That reaction is attributed to the presence of the said virus. The problem with the experiment is how do you discount the probability that the effect or reaction was not caused by the other elements? Where is the experiment where only the so-called virus is present? People often ask, if you say that there might not be a virus, then why are people dying or getting sick? Sicknesses and or death is not proof to the existence of a virus. Thus the need for medical and post-mortem investigations. There are many different causes of sickness and death. It is not just viruses. The lockdown was accompanied by an aggressive media campaign which influenced public perceptions. I personally took a case to court under the slogan, "Show us the virus." As mentioned above, to this day no proof was ever produced. The court instead dismissed the case with punitive court orders against me for daring to ask such a question without compelling Ramaphosa, the Minister of Health, and Professor Salim Karim to provide proof of the virus they claimed to exist. He who makes a claim should prove it. This simple legal maxim was violated when the courts ruled against me. When the national state of disaster is declared, the leader of the IFP, Velenkosi Thabisa, as Minister of Kogta, a member of the pro-Israel bloc of parties, will become the de facto ruler of the republic. A national state of disaster will usher in a police state. I don't know if they will let us out of the lockdown this time. Beware of the wolf in sheep's clothing. Meanwhile, Ramaphosa calls on WHO and partners to unlock support for Africa amid MPox outbreak. President Cyril Ramaphosa has called on the World Health Organization and its partners to unlock support for Africa amid an outbreak of monkeypox, which has been declared a public health emergency threatening the continent's security. In a statement on Saturday, speaking as the African Union AU champion of pandemic prevention, preparedness and response (PPPR), Ramaphosa said he fully supported the Director General of the Africa Centers of Disease Control and Prevention's declaration of MPox as a public health emergency of continental security. This crucial decision empowers Africa's CDC to lead and coordinate our collective response efforts, strengthening the MPox response at every level, from community engagement to collaboration with the highest political authorities and our international partners. The declaration will also galvanize political leadership and engagement among AU heads of states and government, facilitating the rapid mobilization of essential financial and technical resources, he said. Ramaphosa called upon AU member states to increase domestic resource allocation and lead their national monkeypox outbreak responses through a One Health approach to enhance their capacities, particularly in areas such as capacity building, risk communication, community engagement, case detection, contact tracing, and cross-border surveillance. Since the start of 2024, a total of 17,541 cases, which is 2,822 confirmed and 14,719 suspected, and 517 deaths due to MPox have been reported across 13 AU member states. This week, 3 additional countries notified cases were under investigations for confirmation, bringing the total to 16 countries. Alarming, the number of reported cases in 2024 has surged by 16% compared to the same period in 2023, he said. Ramaphosa also called upon African Union policy organs to speed up finalization of the framework to make operational the African Epidemic Fund as approved by the heads of state during the 2023 AU Assembly by the end of August. I have been closely monitoring the evolving MPox situation, regularly briefed by the Director General of Africa CDC and PPPR Commission. I'm deeply concerned by the rapid spread of MPox across multiple regions within the African Union, with a significant rise in both cases and fatalities, reflecting a concerning shift in the epidemiological pattern, he said. Ramaphosa condemned the Permanent Representatives Committee for their decisive action in releasing $10.4 million, which is 187 million rand, from the COVID-19 fund to support the MPox outbreak response. He also welcomed the declaration by the World Health Organization of MPox as a public health emergency of international concern, PHECS. This PHECS must be different and correct the unfair treatment from the previous one declared in 2022, where vaccines and therapeutics were developed and made available primarily to Western countries with little support extended to Africa. I can upon World Health Organization and all partners to collaborate closely with Africa CDC to ensure that this PHECS unlocks appropriate support from the international community, guaranteeing equitable access to medical countermeasures, including diagnostics, therapeutics, and vaccines, he said. On Friday, the WHO Health Organization urged manufacturers to ramp up production of monkeypox vaccines to rein in the spread of a more dangerous strain of the virus. The World Health Organization is asking countries with MPox vaccine stockpiles to donate them to countries with ongoing outbreaks. 2 monkeypox vaccines have been used in recent years, MVA-BN, produced by Danish drug maker Bavarian Nordic, and Japan's LC-16 AFP reported. Health Department spokesperson Mofta Mohale, in response to business reports, said on Friday there was no need for people to panic about MPox, but they should exercise caution and remain vigilant at all times. Mohale said the department has identified a new MPox vaccines for consideration, but the decision on the quantities would be determined by the epidemiological data, rate and transmissions, price, and other factors. The current situation doesn't translate into immediate pressure to secure vaccines, though vaccines are part of our pandemic preparedness plans, he said. None of the MPox vaccines are registered with the South African Health Products Regulatory Authority (SAHPRA) for distribution in the country, but the department is able to rescue them through Section 21 of the SAHPRA Act whenever a need rises. Our immediate priority is to intensify risk communication and community engagement, surveillance and contact tracing activities, Mohale said. Aspen Pharmacare's Dr. Travok Nicolo, who is also chairperson of pharmaceuticals manufactured in South Africa, said that since COVID-19, the fact was that 4 years later there was no vaccine production in Africa, and the continent was reliant on purchasing them internationally. He said predatory pricing from other countries meant it was hard for Africa to get vaccines in a public health emergency. And that's it from Injibs Africa. Stay tuned to USA political updates.